Good day and welcome to the Editor's Podcast. This is Dr. Linda Snetselaar. I'm Editor-in-Chief of the Journal of the Academy of Nutrition and Dietetics. And with me today, I have Dr. Kea Turner, who is an associate professor at the University of North Carolina, and Christina Santiago, who is an MS RDN from Moffitt Cancer Center, where the study was conducted. Welcome to both of you.
Thanks.
Thanks for having us.
Here.
The article which you've written together focuses on the role of nutrition after colorectal cancer surgery. And I think importantly, it's a study of both the colorectal cancer survivors, but also caregivers' experiences throughout the process of post-surgery cancer treatment that does involve nutrition. Please, would you tell us why the topic is important to clinicians working with patients?
This is Kea. Thank you again for having us here today and for this question. After surgery, colorectal cancer survivors have a high risk of malnutrition, which affects patient outcomes such as risk for surgical complications, quality of life, and survival. And while there's a lot of dietitian support while patients are in the hospital, dietitian support often drops off when patients and their caregivers return home after surgery, and they have to self-manage complex symptoms, navigate diet changes, and transition to a survivorship diet over the long term with very little structured support. To ensure that colorectal cancer survivors and caregivers are set up for success, we need to address this care delivery gap and determine how to provide more structured dietitian support for this population.
Thank you. And then what are 3 practical takeaway points from this study?
This is Kea again. I would say that the first practical takeaway is that colorectal cancer survivors found it most helpful to have early engagement with a dietitian. Survivors recommended engagement with a dietitian before surgery when it may be easier to learn new information and to set clear expectations for patients and their caregivers about how difficult it may be for the patient to eat after surgery and what symptoms that they can expect. The second practical takeaway is that maintaining nutrition after surgery requires a lot of behavior change. An ongoing rather than one-time dietitian consultation may be important for that. We learned from colorectal cancer survivors and caregivers that they had to change their routines and they had to problem solve, and some felt that the information that they received during hospitalization didn't really prepare them for that. That's where the ongoing dietitian engagement post-hospital discharge is important. We heard directly from participants that their ongoing relationship building with the dietitian really helped them to successfully change their behavior. And then the third practical takeaway is that resources such as medically tailored meals may be needed to help survivors who are unable to purchase or prepare food after surgery. We heard from colorectal cancer survivors who didn't have any caregiver support and survivors who were experiencing nutrition insecurity that they had difficulty following the post-surgery nutrition guidance from the care team. So those patients may need more support than they're currently getting.
Thank you. Great practical takeaway points. And then the final question, how might a practicing RDN use the outcomes of this study working on a daily basis with patients or clients?
Hi, this is Christina. Thank you for that question. And I'd like to just expand on what Kea has said as well. But for a dietitian working with these post-surgery patients, it's really going to be important to make sure that the dietitian sees the patient after surgery. And so working with the clinical team to ensure that there's some form of referral process, possibly that started in the inpatient setting at the time of discharge, to make sure that that dietitian can follow up with that patient when they are discharged. As well, the dietitian's really going to want to ensure that they're individualizing their follow-up with the patient. Some patients may need check-in a little bit more frequently. Some patients might need check-in a little bit further apart. But typically, we're going to want to recommend the patient and caregiver continue to follow up with the same dietitian to have that relationship building. They'll know the patient's likes and dislikes, what worked well, and can kind of build off of the goals that were set at the previous visit. As well, it's important to talk about expectations with those patients and caregivers often, validating that eating can feel very challenging at times and that symptoms can be dynamic as healing progresses. Dietitians are really going to want to use motivational interviewing strategies to impact those behaviors, assessing where a patient is in their ability to change, and then seeing how they can get them through the next stage of change as well. And being clear in those diet recommendations, rather than only saying what not to eat, also including examples of what patients can be trying for meals or snacks, and continuing to talk through what diet advancement looks like. If patients are still being advised to restrict certain foods after surgery, talk through what symptoms we're looking for before advancing to the next step. For example, if we had a bowel resection as well, we would want to be limiting some of our fiber foods. And what symptoms are we looking for to improve before the reintroduction of fiber in the future?
Thank you. Great ideas for the practicing RDN. And thank you both so much for your work on this topic, which I think will be of great importance to our readership. And I greatly appreciate your research in this area that is very clinically oriented and I think has the potential to help along those clinical lines in which dietitians are currently practicing. I welcome readers to learn more about your research by going to the article titled Managing Nutrition After Cytoreductive Surgery and Hyperthermic Intraperitoneal Chemotherapy, a qualitative study of colorectal cancer survivors and caregivers' experiences. And again, thank you so much. So appreciate being able to talk to both of you.
Thank you.
Thank you so much. It was a pleasure joining you today.
Thank you for listening to our discussion today. Additional scholarly articles related to today's topic are available on our website at www.jandonline.org. If you found this discussion informative, please like and subscribe for more content. Thank you for your time and support.